in the throat, when you open the mouth and when you look in the mouth, what type cancers could be there?
So it's a funny world that we deal with here because it's really one main type of cancer, but it can be on different types of tissues. So it's something called a squamous cell carcinoma. Squamous is that word that means like the lining of the skin. We have those same cells that line our tongue, that line our cheeks, that line the whole back of our swallowing cavity and our breathing tube. And so mostly what we deal with is squamous cell carcinomas, and that could be the tongue. Sometimes that's a lump on the tongue that bleeds and looks kind of angry, but doesn't go away with an antibiotic, and it's not from an irritated spot on the tooth. It's usually lumps and bumps that you can physically see and feel when you're talking about in the mouth and in the oral cavity.
Does it get bigger and bigger and bigger until somebody figures out something's wrong here?
One of the things I like to tell people, just as a rule of thumb, is that cancer has one good thing about it, and that's that its behavior is pretty predictable. So if you've got something that's growing and shrinking and kind of goes away and then maybe it comes back, that's not behavior that we think very much about with cancer. Cancer tends to grow and grow and grow and get bigger and bigger and bigger and more problematic. And so that's one of those behaviors that if you're talking to your doctor and you're saying, hey, I got this spot on my tongue, it gets bigger and bigger and bigger, that ought to be a red flag for people.